We're making this film as part of our community project to help raise awareness of mental health in young people aged 16 to 25 years old and the support available.
This is because it is often an overlooked and misunderstood subject.
We want to inform people about mental health and how it affects young people and identify what help and services could be available.
We are looking at age ranges between 16 to 25 and the support available to them in Salisbury.
We want to promote that it's okay to say having a conversation about mental health can make a real difference.
We intend to interview those working with young people and those that support them with mental health.
We've made this with no experience of filmmaking, no high-tech equipment, but we hope that somebody could benefit from that.
Our team members have worked on researching and planning interviews, helping to develop a film that may help somebody in Salisbury.
Our aim is to provide some information on mental health issues and advice on getting help.
What is your name?
Rob Guy.
What do you do and who do you work for?
I work for Dorset and Wiltshire Fire and Rescue Service and I'm the Youth Intervention Manager.
Have you noticed an increase in mental health conditions in young people?
So I'd say I'm not an expert, but I've been working with young people for over 10 years in Wiltshire and now covering Dorset as well. I'd say there's definitely been an increase in our referrals of young people who have mental health conditions. So I'd say for one of our Spark courses or Salamander courses, which are 5-day intensive programs, I'd say 60 to 70% of those young people identify as having some form of mental health condition. And I think the rise of awareness and the increase in anxiety of young people has definitely been on the increase over that time period.
How, in your opinion and experience, does this affect them in your setting?
So for us, it really impacts on their ability to learn or to even take part in the activities and the programs that we deliver. So we have a number of referrals for all our programs. We're normally always oversubscribed, but there's always a small percentage that don't actually actively take up their place because of anxiety or because they're insecure about their feelings or about issues that might be going on in their life at that time. So it definitely impacts on our attendance and engagement, but also I think their ability to get the most out of a course. I think that's really important for them to gain that qualification or to learn about firefighting or whatever course it is that we're delivering. So I think it definitely has an impact on their enjoyment of the course.
What support is there available?
Okay, so internally from our point of view, we've got youth coordinators who work on all our programmes and they're always at every session, so they'll be there to listen to any young person's needs. And what we do try and do is make sure they've got the relevant training and experience, so they will complete emotional first aid training, mental health first aid training, so they're aware of some of the issues young people might be facing and the questions to ask and how to deal with that. We've also got in support in the fire service with some counsellors. So if a young person wanted to speak to someone away from the youth coordinators who they're dealing with on a day-to-day basis, then we can refer them to those. Externally, you've obviously got youth workers, although they are, I understand they're limited now because of funding cuts and things like that, so there's less of them. You've got CAMS, so there is support there, but obviously that's a referral process. And because of the increase in mental health issues, they're obviously oversubscribed, so the waiting time for a young person to see someone is obviously going to be extended, and I think that's the key thing really, is that you need someone to speak to them ASAP as soon as possible. So there are services out there, but probably not as many as there should be.
In your opinion, do you think there is enough support?
So going back onto that answer, I don't think there is. I think there needs to be more support, particularly for the cohort sort of 16 to 25-year-olds who maybe aren't accessing services, so they might not be engaging in college, or they might not have support from their employer or families or whoever it might be. I think there does need to be more support for those types of young people that do need people to talk to, but maybe aren't accessing people who've got the experience to talk to them.
What do you think should happen or changes made that would make support more effective?
So going back to what I was talking about, sort of youth workers and things like that, an increase in the support where young people can just drop in. I think that one of the services that obviously was around nationally, Connections, was very good because young people could just turn up, knock on their door and just speak to someone and get some support straight away. I think education is improving across the whole country in terms of young people and mental health. But I think probably education in schools at an earlier age. I know that government are talking about increasing that and implementing that. So I think that's really important to ensure that young people appreciate that people do have mental health and there's different scales and things, and that they can talk to someone at an early age, but also recognising if their friends are struggling in who to talk to. So I definitely think there should be education from a lower age all the way up. But yeah, I just think there needs to be more support for young people to just be able to drop in rather than maybe just picking up a phone or something like that. Actual face-to-face contact, I think, is key and important, really.
Okay, that's all.
What is your name? What do you do and who do you work for?
My name is Marcus Fanti, and I run a day centre and training centre for adults with learning disabilities and mental health, and I work for a company called Elaborate Christian Care.
Have you noticed an increase in mental health conditions in young people?
Yes, I have. I think over the years that I've worked here, I'm aware of cuts that have been made by the government. The underfunding that the mental health has always had, and the detrimental effect that it has on some of our service users that we have here.
How, in your opinion and experience, does this affect them in your setting?
I think it's having a knock-on effect, that's for sure. We have some of our clients come in with personal problems that can't be solved outside because of the lack of support or the cut of funding, and I think that then has an effect on our training here. They can't concentrate, or they're having anxiety issues. There's definitely a knock-on effect.
What support is there available?
Well, I think within this organisation, or our environment that we have up at the garden centre, I think it pushes our staff beyond their remit with personal problems, anxiety, depression, inappropriate behaviour, and we are making more referrals to the clinical psychologist and other medical areas.
In your opinion, do you think there is enough support?
No, I don't. We have clients coming in with anxiety issues, depression, where they would have their one-to-one with their outside support. That a lot of that has now been cut. We are also finding that the other agencies are trying to put people with mental health in to our centre through the back door and try to represent them as abled volunteers.
What do you think should happen or changes made that would make support more effective?
I think the government really needs to put more money back into the mental health. I heard recently that Fountain Way is closing down, which puts more pressure on our local hospital.
What do you think should happen or changes made that would make support more effective?
I think the government really needs to consider putting more money back into mental health and stop closing centres like Fountain Way, because it puts extra pressure on our hospitals and other organisations somebody has got to pick up the bill somewhere, whether it's the clinical psychologist. It just goes round in a circle. So by cutting or closing centres, other people have still got to do the job.
What is your name, what do you do, and who do you work for?
Okay, so my name is Lucy Duffy. My job role is Salisbury Food Bank Manager, and I work for the Trussell Trust.
Have you noticed an increase in mental health conditions in young people?
I think there's an increase in mental health conditions across the board. It's very difficult for us here to see whether that's particularly for young people, but definitely there has been an increase and we've seen more clients come through the food bank.
How, in your opinion and experience, does this affect them in your setting?
Well, unfortunately, people with mental health issues have difficulty managing their money, and therefore, and perhaps without the amount of support that they need, they can get themselves into trouble financially, and therefore they have to visit the food bank for extra support. So we've seen an increase of people visiting the food bank with mental health issues who need support in a crisis.
What support is there available?
In Salisbury you've got a community mental health team available, and Wiltshire Mind also, which provides support groups in the area. We also have obviously Rethink, a charity that deals with mental health support. So there are support services available.
In your opinion, do you think there is enough support?
I think there are support groups out there, but due to cuts they're not necessarily staffed as well as they could be, and therefore the level of support perhaps could do with a boost, could do with improving. But yeah, I think if they can be supported better and have more staff, then the actual resources are there available.
What do you think should happen or changes made that would make the support more effective?
I think it would be really good if some of these agencies of support went into schools and gave talks to young people and colleges so that they're aware of what support is available in the area, so they know where to go if they're having trouble with mental health issues. I think also that will take away some of the stigma so that people will feel more relaxed about asking for help.
What is your name, what do you do, and who do you work for?
My name's John Kingsbury and I'm a family key worker and I work for Wiltshire Council.
Have you noticed an increase in mental health conditions in young people?
I think what I can say is I've noticed that obviously my awareness of mental health conditions in young people has improved over the last few years, so I'm more aware than I used to be. And I think partly that's down to training that I've received and an awareness increasingly in the media of how these issues are presented, so that people are more aware of things such as this.
Yeah. How, in your opinion and experience, does this affect them in your setting?
I suppose in my setting, because I was previously a NEET worker where I was working with young people trying to get into employment, sometimes you find that common issues arise such as lack of confidence, anxiety, the sorts of things that can be little barriers to young people getting into work. So what we tend to find is we support young people with those issues and we try and help them build their confidence and build their motivation so that they can move successfully into a job or some form of training or education.
Okay. And what support is there available?
There's quite a lot of support at the moment in the Wiltshire area. There's support in schools with Thrive Hubs, where they've got mental health practitioners available to talk to young people and advise teachers as well. There's also the Wiltshire IAP service, which can give advice over the phone, and they also do face-to-face interventions. And you've also got the CAN service, which is based at Salisbury District Hospital. So there's quite a lot of services available for young people. There's also some websites. There's the On Your Mind website. Have you heard of that before?
No.
That's quite a good website. And there's also Couth Online Counselling for young people, which you can find on the details of that on the On Your Mind website.
Okay. And Do you think there is enough support?
I think there's quite a lot of support out there. It's a lot of very good support out there for young people. It's just making young people aware of the support and making sure that they're confident enough and feel comfortable enough to approach those services and make best use of them.
Yeah. And what do you think should happen, or changes that would make the support more effective?
I think it's about building awareness, about building the knowledge that people have of services that are available and making sure those services are accessible for young people, because there are quite a lot of services out there, but it's making sure that young people are aware of those services so they can access them easily and comfortably and at a time that suits them. Yeah?
Yeah. Thanks for your time.
You're welcome.
What's your name, what do you do, and who do you work for?
So my name's Annabelle Gillam, I'm a family therapist and I work for Oxford Health.
Have you noticed an increase in mental health conditions in young people?
I think we've noticed that nationally there's a growing prevalence in mental health for young people. So overall, yes, it is an issue, but I know that there's lots of input at the moment into funding to increase access for young people to get the right help at the right time.
How, in your opinion and experience, does this affect them in your setting?
Well, I have a slightly different role than mainstream CAMS in that I work alongside Wiltshire councils. So what we're actually doing is there's a transformation plan for improving access to mental health services and improving opportunities for young people to seek help when there's a mental health concern. So from that part of my role, what I'm doing is working alongside the teams in Wiltshire Council to support those teams and to really bring about kind of awareness of what's available in the community and really to help young people access those more effectively.
Okay, and what is the support available?
Well, there's quite a lot. I think my colleague mentioned there's quite a lot. So at the moment in Wiltshire, we've got 12 secondary schools that have a mental health clinician actually in the schools, and they're called our Thrive Hub schools. There's Couth Online Counselling, which has been commissioned by Wiltshire Council, and that's an online service for young people. There's the On Your Mind website that's been developed by Wiltshire Council, which gives lots of information around mental health. And additional access to other services that are community-wide. We have a mentorship scheme in primary schools. There's numerous initiatives that are going on at the moment to actually improve access and to just really bring awareness for young people.
Okay, do you think this support is enough?
I think actually Wiltshire are very forward thinking in what they're doing, and certainly the transformation plan is all about getting the right help at the right time, and that's what we're actively trying to do in partnership with Oxford Health as well. So I think at the moment, yes, it's an area whereby we're really opening up opportunities for young people to get the help and support they need.
Okay, what changes do you think could happen to make the support more effective?
That's really about awareness, and I think the fact that we have now got a number of clinicians in schools. I think we've got the website, there's the online counselling service, there's all of the early help services within Wiltshire Council as well, which are really bringing about greater awareness, and I think young people are getting an opportunity to find out more about those and actually being able to access what they need.
Okay, thank you very much for your time.
Decide who is the best person to talk to. Who would you feel most comfortable talking to? Many of us prefer talking to family and friends, but you may prefer to talk to professionals, support groups, helplines, or online discussion forums.
Pick your time and place. Choose a good time and somewhere you feel comfortable so you can talk uninterrupted in a relaxed environment.
What outcome do you want? Do you simply want to be listened to? Would you like more practical or emotional support? Be clear what you want to achieve.
Make notes. Write down the things you want to say so you can remember to include them in your conversation.
Explain how you feel and what support you would like. The other person will then know how to help you.
It may be difficult to talk about your feelings, but a problem shared is a problem halved. and you'll probably feel better simply talking to someone. When you're feeling down, it's important that you are not struggling on your own. Just ask for some help. It's okay to say.